Hey everybody, welcome back to 5 Minute Sickle Cell Lessons. My name is Marissa Kors. I am your fifth generation sickle cell patient and patient advocate. Today is lesson 8 or 9. We are discussing the sickle hemoglobin and polymerization. That was a mouthful. For those of you who are just joining us, sickle cell is the world's largest hereditary illness. It is the world's largest one gene illness, and contrary to popular belief, it is not just a black thing. Sickle cell is a worldwide thing. In fact, anywhere on the planet where you find people, you can find sickle cell. As sickle cell is a disease of war, migration, trade, but mostly it is a disease of evolution and mutation and the body's attempt to protect itself from malaria, which is something we will get into later. But right now, we are going to talk about mutant hemoglobin S, as it is the origin of all things problematic in the family of sickle cell disease or disorders. So for most people, when we think of sickle cell, we just think of sickle cell SSSC, sickle beta thal positive, sickle beta thal negative, and sickle cell trait. But there are over 30 types of sickle cell known throughout the world. And all of them, every single last one of them, start with this mutant hemoglobin S. And ultimately, what it does to the red blood cell is, and I quote, is the major direct effect of sickle mutations that lead to abnormal red cell flow properties in circulation and the accompanying increase in hemolysis, and thus all clinical manifestations can be traced back to this phenomenon. So this phenomenon that they're referring to is these little rod Twizzler licorice looking things, are nerd sticks. Y'all remember nerd ropes? Nerd ropes that are right here. So let's talk about the nerd ropes and how they come to be. So bottom line, sickle cell patients, we make ourselves happy, whole, healthy, filled with all of the things that everybody else's red blood cells are filled with coming out the gate. And just to give you a rundown, um, our red blood cells, we have oxygen, carbon dioxide, uh, diphos- diphosphoglyceric, diphosphoglyceric acid, and hydrogen ion binding. So this is everything that's going on inside your red blood cells. Okay. And what happens is they come out the gate and they are dropping their oxygen molecules left and right. You want oxygen? You want oxygen? Everybody's getting some oxygen. Great. Problem is that when the oxygen molecules get low within the cell, we start having this intracellular problem, and these little rods begin to form. And ultimately, what's going on is that these polymer structures, as they like to call them, they are attracting to each other like magnets, let's just say, and they're being brought together, and in their being brought together, they are now forming these rod-like structures. Okay, and of course that's bad. And the little rod-like structures, what happens is that they align with each other, and as they're aligning, they are forcing the cell basically to rip apart, or as we say on this channel, implode. um, and when that happens, the cell releases all of its insides, especially these little suckers right here, and the wonderful poisonous uh, iron hemoglobin known as heme, which is incredibly viscous. And what it leaves behind are these wonderful little quote unquote sickled cells, which are now deformed blood cells that are brittle and not sticky and just causing all kinds of commotion in the vein. But what is so interesting about these polymers is that once they get out of the blood cell and into the blood vessel, into the actual vein, along with the heme, is they stick up against the wall of the blood vessel. And I say blood vessel because there's 60,000 miles worth of blood vessels in the adult human body. So that's 60,000 miles between your arteries, veins, venules, and capillaries. And anywhere in that 60,000 miles, you can have this polymerization happening, causing hemolysis, the breakdown of the red blood vessel, and then causing blockages. And I think normally when we say blockages, we're thinking of something round, something circular. We're not thinking of something long and straw-like that, thanks to this heme, which is incredibly viscous and sticky, is now sticking to the side of the blood vessel wall. And what it's doing is it's actually preventing the blood vessel, the vein itself, from regulating blood flow. It's preventing the vein from being able to be flexible, to expand, to cut itself off if it needs to. It's preventing the vein from doing a whole lot of things, but mostly what it's doing is it's slowing down the healthy red blood cells and the circulation that's still coming towards wherever this implosion happened. And now these rod-like structures are sticking and now building out and eventually causing a vascular vaso-occlusive event, or the best one that everyone knows, the vaso-occlusive crises. Isn't that interesting? And in our next lesson, we're going to talk about exactly how the vein deals with these structures and how that affects us.